Accessibility to healthcare is a fundamental right that should be enjoyed by all individuals, regardless of their abilities. However, when it comes to children and women with disabilities in Nigeria, this reality is plainly different. They generally face limited access to quality healthcare, leading to dangerous consequences for their overall well being. Hello and welcome back to my channel, Talking Inclusion with Laraba, where we strive to shed light on important issues affecting the lives of individuals with disabilities. Today, we are addressing a critical topic that demands urgent attention: accessibility to healthcare services for women and children with disabilities in Nigeria. As a disability advocate, it is crucial to advocate for the improved healthcare services that cater to the unique needs of this vulnerable population. Join me as I look at the effects, the statistics, potential solutions to this pressing issue. Let's take a closer look at some of the effects of this healthcare accessibility gap. Firstly, women and children with disabilities often experience higher rates of preventable health conditions due to inadequate medical care. This includes untreated infections, malnutrition, and complications during childbirth. The lack of accessibility healthcare services contributes to increased morbidity and mortality rates among this marginalized population. Now, let's look at a few eye-opening statistics. The Rapid Gender Assessment Survey by United Nations Women revealed that 17% of women with disabilities had increased difficulty accessing sanitary and health products during the COVID-19 pandemic, compared to 14% of women without disabilities. Meanwhile, 25% of women with disabilities reported to have difficulty in accessing medical care versus 18% of women without disabilities. Given that persons with disability generally have more healthcare needs than others, restricted access can have major repercussions, especially for those needing sexual and reproductive health care. Shockingly, in Nigeria, we don't even have a database for persons with disabilities. How can we even talk about giving appropriate healthcare services to girls and women? This lack of numbers needs urgent change. So, what are the barriers preventing women and children with disabilities from accessing healthcare services? One of the significant obstacles is the lack of physical accessibility in healthcare facilities, including ramps, elevators, and accessible restrooms. Additionally, healthcare professionals lack training and awareness to cater to the specific needs of individuals with disabilities. However, it is not all doom and gloom. There are promising solutions that can help bridge this healthcare accessibility gap and improve the lives of women and children with disabilities in Nigeria. Firstly, it is essential to advocate for the implementation and enforcement of the Disability Prohibition Act of 2018. These policies mandate accessibility in healthcare facilities. These include ensuring availability of ramps, accessible medical equipment, and staff training on disability awareness and communication. Secondly, collaboration between healthcare providers, disability advocacy organizations, and government agencies is crucial. By working together, we can establish a comprehensive healthcare program that specifically addresses the needs of women and children with disabilities. This collaboration can include community outreach, awareness campaign, and the development of inclusive healthcare guidelines. Lastly, fostering a culture of inclusion and empowerment is vital. We must encourage the active participation of women and children with disabilities in healthcare decision-making processes. Their voices and experiences should be valued and considered when developing these policies and programs. In conclusion, healthcare accessibility gap for women and children with disabilities in Nigeria is a pressing issue that requires our immediate attention. By advocating for the implementation and enforcement of the Prohibition Act of 2018, fostering collaboration and empowering individuals with disabilities, we can create a healthcare system that caters to the unique needs of this marginalized population.